Okay, I think we'll go ahead and get started. Hello, everyone. My name is David Shapiro, and I'm the program manager and lead advisor of HealthLinks. We've had the honor of hosting 5 previous town hall meetings, and we've been overwhelmed by the response we've had from participants and all of the thoughtful and encouraging questions and comments you all have shared with us over the past 6 weeks. So thank you. And thank you again for joining us today. Today is our latest town hall meeting, the 6th virtual town hall we've had in our series dedicated to providing all of you with trustworthy information during these challenging times. PPE and risk reduction, what to do at work and home through COVID-19. The pandemic has impacted all of us and all of our work. And today we're sharing information about PPE or personal protective equipment and research-informed strategies to reduce your risk at home and at work. As we begin the return to work conversation throughout Colorado and our country, our collective understanding about PPE and risk reduction is really critical to reduce the spread of coronavirus. HealthLinks is committed to providing these town halls and to provide you with tips and resources to support yourself and your team. And now more than ever, we're really committed to the health, safety, and well-being of workers and the workplace. We're all in this together, and we're stronger when we focus on public health and supporting one another. One note I'd like to make here at the outset is we will not be offering CHES credits or SHRM credits for today's town hall meeting, unfortunately. One of our previous communications about this town hall mistakenly indicated that these continuing educations were available, and so I apologize, they are not available for today's webinar, and if it causes any inconvenience, we apologize. HealthLinks is a mentoring program that champions health and safety at work. Our mission is to advance worker health, safety, and well-being. We offer evidence-based healthy workplace certification and advising to help organizations and their teams achieve total worker health. As a nonprofit program of the Center for the Health, Work, and Environment at the Colorado School of Public Health, our experience as researchers informs everything we do. Our center is one of 6 centers of excellence for total worker health, funded by the National Institute for Occupational Safety and Health at the Centers for Disease Control and Prevention. A few housekeeping items about today's town hall meeting and this webinar. All participants are on mute throughout the duration of today's presentation. We'd like you to use the chat function on your Zoom toolbar if you have any technical issues related to today's presentation. And we do have time slated for Q&A once our presentation has concluded. And you can use the Q&A box on your control panel of your screen to ask any questions of the panelists and of myself. The webinar is being recorded, pardon me. And we will be able to share the link of both the recorded webinar and the slide deck at the conclusion. You'll receive an email follow-up, and we also post these resources on our COVID-19 resource page under our town hall section for the Center of Health, Work, and Environment website. There will be a brief survey at the end of the webinar. We want to continue hearing from you to inform upcoming topics. And so we ask that you take a moment when we wrap up today, when you close out your Zoom link, to fill out the questions of the survey. It really does help inform today the future town hall meetings and get a pulse of what people are needing in terms of information moving forward through these challenging times. Quick overview of our 45 minutes to an hour together this morning. As far as our agenda, we'll hear from our presenter, Dr. John Adgate, who I'll introduce in a moment, followed by a question and answer section. I know that in previous topics and webinars we've had around and I've participated in, there's a lot of questions about personal protective equipment and face masks. So you'll have a chance once Dr. Adgate wraps up his presentation to ask a few questions as well, and I'll be moderating those questions directly with our presenter. So remember to type your questions into the Q&A box in the control panel of your Zoom screen. I'd like to introduce our distinguished guest and town hall presenter today. Dr. John Adgate is professor and chair of the Department of Environmental and Occupational Health at the Colorado School of Public Health. Dr. Adgate is an exposure scientist interested in the impact of chemical and non-chemical stressors on human health and disease development. His current research focuses on impacts stemming from energy development, the consequences of early chemical exposures on children's health, and the influence of a changing climate on building and occupant health. Dr. Adgate's research interests also include air pollution exposure and health and air pollution risk and assessment. And I know Dr. Adgate has been pulled into a lot of the state's conversations around PPE and risk reduction, so we're honored to have him present today. So thank you, Dr. Adgate, for joining us today to talk about risk reduction and PPE, what we should all be thinking about and doing when it comes to work, home, and through COVID-19. So I'm going to pause my screen share now, John, and unmute you, and you can share your screen as you're ready.
Alrighty, let me get to the right place here. There, does that look right?
That looks great.
Okay, thank you, David. That's a very generous introduction. I appreciate it. So what I want to talk about today is personal protective equipment. That's what PPE stands for. But I want to talk about it in the larger context of what's going on around COVID-19. And I think as I talk to people and walk around in my daily life, I think there's a lot of anxiety about masks and what to do and how best to do it to protect oneself and one's family. And hopefully some of this will work to alleviate some of your fears and spur some good questions about the process. There we go. So I thought I'd start here because you know, we're in the era where everybody's supposed to wear a mask if they're out in public, particularly indoors, in places where we might congregate. We're still supposed to you know, have some physical separation, but masks are one form of personal protective equipment that are used. And you know, here's our governor, and here's somebody walking out of the grocery store, and you know, we're all in this zone for a while, I think. So we need to make use of them. What I want to talk about is how useful they are and other sorts of risks that I think everybody's familiar with and probably worried about. All right, so really I want to talk about these three things, you know, personal protective equipment and COVID-19. I want to distinguish, you know, the virus itself, which has this fancy name, SARS-CoV-2, as opposed to the disease, COVID-19. So everybody's heard about N95s. You know, I would not have predicted 6 months ago there was such widespread public interest in the topic. But that's what happens when the world gets turned on its head. So I want to talk about various types of masks: N95 surgical masks and homemade masks, and the relative value of each and what they can and can't do. And then I want to talk about, you know, what are we trying to protect ourselves from? You know, what is the 6-foot rule based on? What can these masks do? I also want to talk a little bit about what the virus is on surfaces. You know, what can you be exposed to, and what can you do to protect yourself and your family? And since we're all sort of working at home, the difference between work exposure and home exposure is really, in many ways, non-existent. I thought I'd start with here. This is something that professionals in this field use a lot. It's something called the hierarchy of controls. And the way we think about problems in trying to solve public health problems, particularly in the workplace, but this applies now just about anywhere, is how to stay away from the thing that you're trying to prevent. You know, in this case, you know, elimination, so, you know, it's this pyramid moving from the most effective to the least effective. Elimination is the most effective exposure control, whereas personal protective equipment is the least effective. If you look down here at the bottom, elimination is the stay-at-home order or variance on that, whereas PPE is down there at the bottom, and that's essentially masks. Now, the authors of this particular version of the hierarchy controls, which can be applied generally to just about any problem, workplace exposure, be it air pollution or microbial, viral, physical hazards is what do you do and what are the most effective ways to control the exposures and prevent health effects. So as you move down this inverted triangle from elimination to, for example, engineering controls, which in this case could be things like hand washing and surface cleaning, which we'll get back to in a bit, all the way down to what they're calling here administrative controls, the 6 feet rule, and lastly to masks, which as I've said already, and it's really important, they're in many ways the least effective because they need to be extremely good to be effective, whereas a lot of the other things higher up on this inverted pyramid are much more effective. Hand washing and staying away from places where you can become infected are really what's key. All right. Not to be too much of a science geek, but you need to know a little bit about how masks work. Now, as I said, N95 has suddenly come into public parlance. It's a mask that's 95% efficient at filtration of small particles in the air. And 0.3 microns is sort of an interesting size point, but just to give you some context, a human hair on your head is about 70 microns in diameter. The virus itself is around 0.3 microns, so you can see it's almost 100 times smaller than a hair on your head. Now, these small particles, 0.3 microns, are the transition point between acting like a gas and a particle, and that's important because they're the most difficult particles to filter out. So since the virus itself is about 1/10 of a micron, that's a relevant size range. Now, the virus itself is small, but is typically, when people get exposed to it, it's on some sort of droplet, like when people sneeze or cough, and we'll talk about that more in a minute. So the aerosol science tells us that mask filtration is important, but what's also extremely important, and I think overlooked in a lot of cases, is how the mask fits is a big deal. When they're used in occupational environments, for example, in hospitals and other healthcare environments, annually people go through a fit testing process that ensures that the mask fits well around the nose, and as a consequence, multiple sizes are needed, and men shouldn't have facial hair, and so on and so forth, because all those things interfere with the ability of the mask to filter. So just to give you a visual here, this is from the aerosols that we emit, for example, when we cough or sneeze, if you're infected, are typically going to be on the order of anywhere from 1 to 100 microns in diameter. Remember, the virus is 1/10 of a micron. If you cough, you can spray are typically called large droplets, and those are ones that are up to about 1/10 of a millimeter, and that's visible to you, whereas 1 micron particle is barely visible, if at all. You have to have sharp eyes to see that. So what you see here is that these bigger particles are going to fall out, although in an indoor environment, they're typically going to remain suspended in the air, depending on how good your ventilation is. And there's some emerging evidence that the virus is transmitted this way, that people are breathing it in. So really, indoor environments and spacing and ventilation are key to addressing, reducing exposure in people. Now, there's work going on that. I've signed an international letter by a famous aerosol scientist in Australia that she wrote on this whole issue about transmission via the air. And the key point here is 6 feet is, I think, in many ways, a sort of a minimum. If you can make larger spaces between you and others, particularly in indoor environments, if they're shedding, that's key. So my point here is that these cough and sneeze droplets can reach beyond 6 feet. The larger particles can be blocked by a surgical mask, and I'll talk about that, what a surgical mask is. those get stuck in your upper respiratory zone, whereas the smaller particles, the ones that are less than 10 microns, get down into your lungs. These are what an N95 mask was designed to filter, to be 95% efficient at removing these. All right, so here's a picture of some N95s. You know, they're in short supply for healthcare workers, so there's a number of things that have happened that have I think, helped improve supply. But it's a filtering facepiece respirator. It's made out of this high-tech woven polypropylene. It's damaged by solvent and heat, so don't put it in your oven if you've still got any. The systems that have been developed to clean them involve UV light and other chemicals. They are equivalent to protection in this what's called an elastomeric respirator. The key thing about the healthcare masks is that they provide what's called splash protection. So, you know, typically healthcare workers, particularly those working with high-risk patients, are also going to have a face shield. But it's droplet and aerosol protection. Now, if you picked up some masks, you see here that I just animated a little circle around this industrial mask, and notice the difference between this and the healthcare mask. There's this emissions port, that little white thing in the middle of the mask that says 3M on it, is actually where when you exhale, there's a valve to let the air out, so there's adequate pressurization. Note that could actually be a source if you're shedding the virus, whereas the healthcare masks have some filtration around that. So even if you got an N95 at Home Depot, if you managed to get some, for example, you know, they're not perfect protection. So that's what an N95 can and can't do. The other thing to note about these, if you look at the upper part of it, there's a little ridge, metal ridge, that to help improve the fit around the nose, which is really key, because if the fit isn't good, it's almost like not wearing one in a lot of cases. All right, so the fit testing that's mandated is specific to the individual and is typically done with spraying an aerosol that is either sweet or bitter as people go about sort of work-like activities, and that's how you can tell if they seal well. Now, a surgical mask, which is the other sort of common protection that's out there, is this multi-layer synthetic fabric. They're mostly designed to resist blood spatters and other sorts of, and provide some filtration, but they don't fit perfectly. There's not nearly as well as an N95 typically, and they're sort of droplet protection. That's, by droplet, it's the bigger particles and not the smaller ones that are going to get deep into your lungs, which I think are really the concern for transmission, particularly indoors. All right, so just to summarize real quickly, you know, big particles, the ones that are 100 microns or more, are produced by coughing or sneezing, but these can only really travel around 6 feet and will settle out. Although in an indoor environment, the smaller particles, ones around 10 microns, these will travel short distances, but in a well-mixed room or place where there's sort of active ventilation, they'll still stay in the air for minutes to hours. So it's still a concern, which is yet another reason why social distancing is important. N95s will help, and surgical masks will help with the bigger particles and these activities, but homemade masks, which, you know, most people have access to now, won't reduce transmission to these smaller particles, the ones that are on the order of the size of the micron, although they're also likely to get deep in your lungs if you're exposed to them. All right, so I think that's slide 10, right? Is this the point where we were going to do the first question, David?
Yes, I'll go ahead and get that pulled up. All right. We'll just wait a little bit for some of the responses to come in. I'll give it just another moment here. Still have a lot of people tuning in. All right, looks like it's starting to slow down. So I'll go ahead and share the results. Dr. Adgate, can you see the results on your screen?
Mm-hmm. Yeah.
Great.
Yeah. So 80% got this point. All right. So moving forward and shifting from personal protective equipment to the virus on surfaces. There's an interesting and emerging literature on this. There's a lot of people have done work. I want to point out there's a long history of this. This is transmitting viruses to people via surfaces has been a concern for a long time. This term Fomite has been coined to use, and the reason I'm showing you this is because it's been a concern for just about every infectious disease. If you see here, there's a picture of this camp Laziar where they did yellow fever experiments to indicate that yellow fever wasn't transmitted by infected clothing. Now, the reason this is important in this case, and I think you could have infected clothing in our case as well, but it's easily solved by washing it. The reason this is important is because the COVID virus pretty clearly people are shedding it often before they have any sort of symptoms. There's some data that indicate that they may shed the virus for up to 6 weeks, which is while they're asymptomatic, which is sort of the if you remember the term typhoid Mary, that's related to that. It's the same phenomena. Is someone who is shedding the infectious agent and exposes a lot of people. Now, how much and how long these viruses last on surfaces is a slightly different question, but it's obviously a big concern at this point. But how much of the virus remains viable and able to infect people is really a harder, more curious scientific question. But in the end, it's determined by what scientists call half-life. It's like how long are the viruses on surfaces able to remain infectious? What's the time till half of them are reduced or deactivated? Now, the coronavirus has this envelope around it that helps it from drying out, but typically a few virus particles on any sort of surface, particularly if it's in the sunlight, will be deactivated relatively quickly. And by that, I mean hours. Now, the reason we're concerned about this, obviously, is we touch all sorts of things, doorknobs to any sort of surface. And if you can get it in your hands, you can then transfer it and potentially infect yourself or infect others. All right, so I mentioned the term half-life. These are also the times where we're talking about the virus is undetectable on a surface. So a lot of this depends on how much of the virus it was originally laid down. If somebody coughed or sneezed on a surface, that would be sort of that process, or one of those droplets that I talked about in the aerosol science part of this talk ended up depositing on the surface and sort of dried out. But the key point that I want to make here, because we're all worried about, should we wipe down our groceries or our Amazon packages? If you start with more virus in the surface, you'll have some infectious virus around for longer, though how long is still a bit of an open question. But luckily, there is a little bit of science on this. There's this paper where people, I've talked to several people who've at least gotten some sense of this from Twitter or from just talking to friends and colleagues. What they did is they applied a related virus, a coronavirus, to these different surfaces, copper, cardboard, steel, and plastic. And the takeaway has been that plastic, things are going to last a lot longer on plastic. If you look at this bottom circle here, what this is showing you is the half-life is sort of the vertical axis, and then there are different surfaces around the horizontal axis, and it's sort of different different treatments. This has been taken to mean that plastic, the virus is going to be there a lot longer. So if you, the initial take on this paper was that copper and cardboard were, the virus disappeared a lot faster than on steel and plastic. But the absolute times to undetectability on a surface depend really on how much virus was laid down. The people were concerned about plastic, and this has made it out of the news media, probably because they used a very a large amount of virus. It was like 10 to the 7 virus particles. That's a lot. You know, that's in the billions. Or millions, excuse me. While a infectious or shedding individual might shed that much in a cough, that's an unusual set of conditions, and hopefully they wouldn't be out somewhere where they're creating, you know, the fomites on surfaces for others. So in the case of this perfect storm, what I'm calling it, i.e. somebody emitting a lot of the virus and ended up on a surface, the surface type probably doesn't matter much, because whether it's plastic or cardboard, if a lot's there, it's going to take days for it to be deactivated. Although, you know, if it's out in the sunlight, if it's low humidity, there's a lot of other things that can affect sort of viral load on surfaces. So the good news here is that in most cases, the virus is likely viable on surfaces for hours at most. And that's by avoiding sort of the perfect storm scenario I just laid out. I want to point out that common hand soap and detergents wipe out the virus if properly used. So sanitation needs to be the goal. I mean, I'll talk a little bit about disinfection in a bit. Like, they're doing active disinfection of N95 masks now for workplaces. But you've got to have industrial scale ultraviolet light, or right now they're decontaminating N95s with hydrogen peroxide vapor. Two things you don't or shouldn't have at home. But so we need to rely on soap and water, and social distancing is my point. So what should you do? There's some best practices that I think are nicely summarized in the materials I want to show you now. And these were created by some scientists at Johns Hopkins University. That's what the JHU is on this slide. Should you wear a homemade mask, even if you don't think you have are infectious? The best way to prevent infection is to limit your exposure to other people through social or physical isolation and practicing hand hygiene. The key point of wearing a mask is protecting others from you, frankly. It reduces our ability to shed virus. So that's, I think, it's really a sort of the social contract. It won't protect you from becoming infected if exposure comes from somebody who's shedding a lot or is a strong source, which is why social distancing is important. So if you're going to wear a homemade mask, what are some of the best practices? Now, I also want to point out that homemade masks can be quite good. And I'll show you sort of the continuum of their effectiveness in a bit, or at least under specific scenarios. But if you're going to wear them, you need to wash your hands before you put them on, and you go to the grocery store or somewhere out in public where you're going to be around people. You know, secure it properly. Wash your hands every time you touch your mask. Yes, every time is the guidance here. Wash your mask every time you remove it, if it's a fabric one. I'm more a bigger fan of some masks that I'll show you in a bit, because they're effectively disposable. These shop towel masks that I'll show you a picture of. So assume that there could be the virus on both sides of the mask anytime you touch it, and wear a clean mask. You know, I know people who have created or have acquired several cloth masks. My daughter doesn't like to wear the shop towel mask that I've created or manufactured at home, so we're having her wear a cloth mask. All right, this is a bit of an eye chart, but I think it's useful to sort of walk you through a couple of things. So what this is attempting to show you is the level of protection on this sort of vertical axis, and then the hazard level on the horizontal axis. Now, the key point I want to make here is that if you're out and about, you don't actually, I think in most cases, need to be wearing a mask as long as you're outdoors and 6 to 10 feet away from everybody else. That your risk is very low under that scenario. Now, moving to other scenarios where homemade masks might be useful, if you look here, you know, the A in the first circle showed you walking outside alone. Once you move to urban areas and retail stores, a homemade mask provides some protection. But if you move up to a surgical mask, they provide a little more protection, although it depends on the mask, both the surgical mask and the homemade mask. Now, as you move into riskier and riskier scenarios, if you again look at the hazard level down at the bottom, and so from public use to work use, ideally a fit tested N95 is going to protect a lot of workers in healthcare environments, which is, I think, the key concern at this point. So if you're want to make your own masks, I have made a number of these masks. They can be made with a paper clip, rubber bands, and a stapler, as long as you have some of this shop towel material. The video to watch this guy make them is on YouTube. It's in the resources at the end of this talk. And these are pretty straightforward to make, and as I said, disposable. You can make one in a couple of minutes once you get a little practice in, and I think they're quite useful. These are shop towels, which are sort of a high-grade paper towel that have this sort of pressed cellulose. And there's actually some data, if you look on YouTube, there's a subsequent talk by this fellow talking about inhalation toxicologist at University of North Carolina, and it actually tested these, and they're N95-like if properly made. And the nice part with the paperclip around the nose, you bend it out and use it to sort of help your seal around the nose. They are pretty effective, I believe. So there's still an N95 shortage, although the disinfection process has improved that, but there's still PPE is in short supply. So I think for those of us in our homes and as we return to work, the key point is going to be reusing disposables or disinfection of our cloth masks. You still should sort of, the 6-foot rule is important. It's not based on real hard science, and 6 foot is good, 10 feet is better if possible. And you should wear a mask mostly to protect others, but when you do so, wash your hands frequently, socially isolate to avoid infection as possible. But as we roll this out, you know, I think people are going to get tired of social distancing, but it's still in many ways the best advice until the pandemic wanes. Fomite transfer, i.e. viruses on surface, is possible, but cleaning and sanitizing regularly will help reduce risk. In most cases, the virus isn't going to exist on surfaces for more than a few hours to a day. I think is largely what the data show, although again, the perfect storm can happen, so be prudent. Here's a list of resources, including the shop towel mask and some of the graphics in this. There's some, if you want to read further, these articles from the Hopkins lab or CIDRAP at the University of Minnesota are quite good. The complexity of this problem, these articles by Ed Young is misspelled here, it's Y-O-N-G, is excellent. It's a recent article in the Atlantic that I encourage people to read if you want to sort of understand the uncertainties that scientists are grappling with at this point. And I'll close there and be happy to try to answer questions that people have, and thanks for the opportunity to speak to you all.
Thank you so much, John. If you stop sharing your screen, we'll go back into, yeah, great, sort of panelist or presenter mode. A lot of questions came up about masks. I think this is a question that people are really grappling with, trying to figure out homemade masks. I guess I'm trying to lump some of the questions together because we've had 30 or so questions. A lot of questions on how we can reuse masks. So one, first questions come up around for people that do have N95 masks. How often can they reuse them? Are there any tips about cleaning them at home that might be effective for people?
There's an extra slide at the end where somebody took N95s and tried to clean them. There's been a little suggestive that if you put them in an oven at like 150 degrees, that might work, but I'm frankly pretty dubious. The only things that seem to work and maintain the integrity of the masks, I mean, these were designed to be disposable. And the only thing that seems to work are these fancier things that are now being applied at the industrial scale. Battelle has developed this, hydrogen peroxide system so healthcare workers can do that. And there's another system that uses ultraviolet light. But I'm afraid if you've got an N95, I think you'd be better off making or acquiring disposable washable masks. And N95s are not washable in most cases to maintain their integrity, unfortunately. So I think that the best approach is cloth masks where possible, and as the N95 supply goes back up. But I would be cautious about using, as I pointed out in the talk, about the sort of the industrial N95s, because those have a little different purpose there to keep people from being exposed to dusts and particles created in the work process. But that since the main point of a mask is to protect others more so in many ways than ourselves, the exhaust valve becomes a potential exposure source I think that we want to stay away from.
That makes sense. Thank you. So you talked a little bit about cloth masks and people using those. You just mentioned that washing them is an effective way. There's been some questions about leaving them out in the sun or ironing them. What are some, best practices in terms of cleaning your cloth mask?
Soap and water detergents destroy the coronavirus. I mean, it can't stand up to that. I mean, this is it's simple. Sunlight's good too. I think best practice would be to run through your washing machine or, put it just in soap and water and leave it out in the sun to dry. We live in Colorado, particularly these days where the weather's nice. You can wash your mask, and depending on the thickness of the fabric, it'll be dry in an hour or two. Particularly if you leave it out in the sun on a day like today. So I think, having a few masks, cloth masks, and frequently washing is a good strategy. The key thing is you want to make sure that the ties around it still work well. They need to seal around the face as best they can, and particularly around the nose to be effective. Like I said, I'm a bigger fan of the shop towel masks because they're disposable and you can make one. I mean, I got, for $5, I got 2 rolls of shop towels, and the only other things you need are staples, rubber bands, and a paper clip that you unbend. And what I've been using is just those, and then I pitch them after I go to the grocery store, and then wash my hands.
Okay. Thank you for that. One more sort of follow up on masks, and I remember from your presentation a few weeks ago at Research in Progress, there's a lot of questions about masks as well. Does it matter if people use hot or cold water when washing a cloth mask?
I wouldn't think so, although you might be concerned about shrinkage. Depending on the fabric that it's made of. The key thing is I think just some soap, detergent, doesn't need to be anything fancy. In many ways, I know people are very, people have been hoarding, or, you still can't get hand sanitizer, the alcohol-based ones.
Right.
Frankly, that works, but soap, good soap, good detergent works as well or better.
Right. Okay. Good to know. I guess last question there is, people are asking about the shop towel. You said is made out of shop towel materials. What about like using different types of materials? Coffee filters along with cotton or silk or sort of like
Yeah.
layered fabric. Is that a best practice if we're doing?
Well, it's a reasonable practice. I mean, if you actually go and look at the literature, the thing that's most effective is like a HEPA vacuum bag. If you can make your mask out of that, you can do that, but you'll find it's pretty hard to breathe through.
Okay.
There's a lot of back pressure on it. So I think the shop towel or something on that order is a better bet in a lot of ways. It provides probably about the right level of filtration. Now you can combine, various fabrics with into a couple, 3 layers and get close to that, but that pretty soon there's a push and pull between how many layers and how effective the filtration is. If you look at the literature, for example, a bandana, that thin cotton fabric is really about a half or a third of as effective a filter as an N95. Whereas these sort of cellulose filtration that a shop towel or multiple layers of paper towel with a cloth mask will provide is better. Again, I don't want to get too caught up on the filtration because fit is important as filtration, and I can't say that enough.
Right.
So as long as the seal's good here and you wear it properly, you keep it on all the time. I mean, I've gone a number of times already to either the grocery store or businesses that are doing going and buying takeout to support a local business. And I'll see somebody who's, only wearing one side of the mask, or they don't have it looped. And, frankly, that's, why bother?
Okay. Good to know. I'm going to switch over to some questions we've had about airflow and air movement, because there's been quite a few questions that come about that. First question was, and I think you addressed this, but I just want to clarify, in the indoor environment, is it better to have more airflow or less?
It would be better, I think, to have more, just because then you have evacuation, as long as it's going out somewhere. Having a fan in a room with somebody who's infectious and the air just recirculating in the room is different than having like an HVAC system that's going to pull air out and send it outside so you get return air. I'm thinking of healthcare environments. They typically have very high air exchange rates because as in all things, the solution to pollution is dilution sort of issue. And so if you're in what you want to do, for example, if you've got a family member who's sick, you want to stay out of the room where possible. Where you have to interact with them, it'd be good to have, if you can set up some local ventilation where, fan pointed out the window, that something as simple as that will have an effect. But my main point in time about that is this is partially about return to work.
Right.
Those virus particles that people could be shedding, or asymptomatic people could be shedding, or sick people can be shedding, can stay in the air, minutes to hours is I think quite likely. Now, how long they remain infectious is a slightly different question. That's also part of it. But that's why both social distancing and filtration to the extent possible, or good air exchange in a building is important.
Okay, so it sounds like that that access to outdoor air, or getting to air to move through from indoor to outdoor, is really the key in terms of air flow.
Yeah,
because that was
it's
the
basic
question around transmission dynamics here.
Yeah, it's basic. It's ventilation.
Okay.
We all sort of know that when when you're cooking in a room and you can smell the garlic or whatever, you turn the fan on, right? You pull some air in, or you evacuate the odor, and it's the same idea.
Okay. Anything having to do with CO2 exposure, is that related at all? There was just a question that came up about keeping CO2 levels down might be a way to make sure that air is coming in from the outside environment.
Sure.
Okay.
Yeah, absolutely. I mean, it's CO2 levels are an indicator of how good the air exchange is in the space you're in.
Okay. There is some concern from people. Last one about air exposure, about about being outside without a mask. And I know you spoke to that earlier. It sounds like if we're keeping physical distancing in the appropriate measures, being outside is a place where we're relatively safe. Is that
Yeah,
fair?
I would say that, you know, particularly on a nice day, on a sunny day with a little bit of wind, you know, the virus is going to be deactivated quickly if people are shedding it. And you know, the risk is just very low because the transmission probability is very low, I would say. You know, that what we want to avoid, and the reason social distancing is important, is in indoor environments and with people who are asymptomatic but shedding the virus are, I think, the key risk factors. And to the extent that we can prudently reduce that possibility, I think we'll, as a group of human beings, as a society, will be fine. You know, more social distancing is better, but you know, beyond 10 feet, the probability of, I think, running into a viable virus is pretty low in the outdoor environment.
Okay, great. I want to shift over to some questions we've had coming in about return to work, as you know, people are sort of looking at that at various parts of our state. So questions have come up in terms of, and I'll try and group them again, when people should be wearing gloves or like a full kit or body, you know, more body protection than just a mask, as well as sort of what recommendations are for return to work and PPE in office settings.
Mm-hmm.
So I guess the first question is, when do we, you know, what are your thoughts on when we should be wearing even more than just masks? When and how would that be necessary? And then also a follow-up to that, just talk a little bit about, you know, office buildings and some of the concerns maybe there.
Yeah. Well, I'm thinking about, we're in the process of like trying to figure out how to get back into labs at the university, and the advice is we have to maintain social distancing even indoors in a relatively well ventilated building. They want 6 to 8 feet. They don't want more than one person in a lab bay. That's one work environment I spend time in. I think most businesses, you know, I think for people like high risk people like cashiers and others, I definitely think having gloves is a good thing, and that should be bright. I think those people should wear masks. I know a lot of grocery stores have gone around and put up these splash guards. I'm a little dubious on their value relative to social distancing, just because I think the virus can be transmitted in the air, and that plexiglass isn't going to help much, except maybe to stop a sneeze. But anybody who's sneezing like that shouldn't be out anyway, as part of their. I like to think of this as it's all part of, we're all in this together. It's a social contract, and that's what we need to care for each other. That's what we need to do. So gloves, everybody should be wearing a mask when they're in contact with other people. You know, in higher risk things, you know, particularly in healthcare workers, you know, the splash guards are important. I think there's been a lot of work to create and produce those locally. And I'm not aware that they're in short supply. But again, that really is about exposure to people who are symptomatic and or shedding a lot, which I think is rare in most cases outside of the healthcare environment.
Okay. Yeah. So, gosh, so many questions coming in. There's no way we're going to be able to get to all of them. You know, people are concerned about their own return to work, their own environments, their own households even. There's been a group of questions around asymptomatic transmission and asymptomatic viral shedding. And so wondering how you feel about general health screening as people come back to work, if that's an effective strategy. I know that that's been recommended and organizations are starting to do that. What would that tell us, or how would that be useful?
Well, you know, most of what you see is I had to take a family member to a healthcare facility, and you know, there was 3 screening questions, and they were, you know, where have you been? Have you had a fever or felt ill? And then, you know, taking people's temperatures. And I think those are likely to be employed for a while now. How effective they are is a different question. I mean, they're sort of rough tools. Certainly the fever issue, I think, is at least kind of an objective measure. How good it is at preventing spread, I don't think anybody knows. I don't know. There may be data coming out on that. So we're back to, wear a mask, wash your hands, maintain social distancing as appropriate, and hopefully that reduces transmission as much as possible.
Okay. The other thing I know from some of your colleagues in environments where people maybe cannot necessarily do the 6 feet of distancing, I've heard that at least working back to back may be better than facing someone. Is that a fair assumption?
Well, it makes sense. I mean, when we breathe, we're exhaust fumes, so to speak. So if you're working back to back, that's better. But if it's really being transmitted in the air over a few feet, that it's not perfect. Unless there's extremely good ventilation. I mean, you're seeing several industries, for example, food production, meat packing, where there's been these big outbreaks. And those people have typically worked pretty close together. And how distancing works in that environment is, I think, one of the real challenges. In any sort of manufacturing environment like that while airborne transmission hasn't been proven in all cases, it's extremely likely. I'm almost certain that it's true, but how that works, what the right distance to protect the most people is more is better, unfortunately, and there isn't a firm rule beyond that.
Great. Any final parting thoughts, John? I want to make sure that I'm able to conclude, but clearly, you've done a lot of work and research on air transmission, face masks, cleaning solvents. I think what we heard there too is that soap and water, regular soap and water works okay for people. There was a lot of questions there about, does it have to be bleach based? But any final thoughts for us as we
no, I don't, bleach is fine, it's effective. Soap is better because it's about breaking down the lipid around the virus that protects it from drying out and being deactivated. So I'm serious when I say soap and water destroys this. It's better than the alcohol-based sanitizers and probably better than bleach, though I haven't done that comparison. As long as you got soap, you're all right. If you don't have bleach, I know bleach is probably in short supply still. So I wouldn't worry about that. Soap and water are our ally here. They're cheap and effective. Everybody's got it in their house already without having to go out. So I wouldn't worry too much about bleach if you got a good soap.
Great. Thank you so much. I know we weren't able to answer all the questions, but I really appreciate you being willing to respond to the questions that came in.
All right. Well, thanks for the invitation. Appreciate all the interest in the topic and happy to answer questions.
Awesome. A few more wrap-up notes. I'm going to share my screen again here. We've gone through the Q&A section of our talk today, and I want to mention to you our upcoming town hall. We're going to actually have 2 town hall webinars next week that are follow-ups. This first one we have final information on, and you will receive a registration link for both of next week's town hall webinars in the wrap-up to today's presentation that's coming in the next day or so to your inbox. So on next Monday, May 11th, we want to share with you that we're going to be hearing from Courtney Welton Mitchell. She's a social psychologist and mental health clinician. And her experience includes studies focused on the development and testing of health interventions for use in disaster and also in humanitarian settings. She's conducted research domestically and internationally on responses to public health messaging. And in her current work as a clinical assistant professor at the Colorado School of Public Health, she's supporting the Public Health Preparedness and Disaster Response Certificate Program. And she's been engaged in grant-funded research through the National Hazard Center. So Courtney's talk is really going to be around communications, risk communications, crisis communications for leaders and organizations as we return to work and through COVID-19. We've all seen the importance of clear concise and consistent communications, which has been actually hard to sort of understand with so many different messages coming at us today in today's environment. We really appreciate Dr. Adgate's presentation, which has some clear tips about face masks, social distancing, airborne ways to reduce airborne exposure. And so, you know, these sort of clear and concise messaging is really important. So Courtney will be talking to us about how to understand risk communications and factors that may interfere with compliance, as well as designing some strategies that take these factors into account for your organization and for all of us as we communicate. We are planning a second town hall webinar for the next week as well, which is going to be another conversation about best practices for return to work. We know that many of you are being invited back or asked to come back to the workplace, and there's fear there, and we want to acknowledge that as well. And also we want to talk about what best practices are. And so we're, in addition to having this presentation on communications on Monday, May 11th, you'll see in the follow-up email that we're going to host a webinar on Thursday, May 14th as well. So stay tuned for more information about both of them. Finally, want to make sure that you can stay connected to HealthLinks, to our presenters. I mentioned at the outset, I'll say it again, we will be sharing Dr. Adgate's presentation from today in the follow-up to today's webinar. So the presentation itself will be available, which has that resources slide that he shared at the end on how to make your own masks via shop towels, etc., as well as the recording of the webinar. So you will get both of those. They'll also be posted on our center's COVID-19 Town Hall research page. A few ways to stay connected with HealthLinks. We want to make sure you can get in touch with me. As I mentioned, my name is David Shapiro. I'm the program manager. The general contact at healthlinkscertified.org inbox is a way to reach me, as well as through our website, healthlinkscertified.org. Social media is another place where we share a lot of information and resources. Our social media channels include at HealthLinks Certified on Facebook, at HealthLinks News on Twitter, and our company profile on LinkedIn is HealthLinks Certified as well. So once again, we thank Dr. Adgate for presenting today. Thank all of you for participating, joining us for the webinar. Stay tuned for our upcoming town halls. Stay safe out there. You know, really still social distancing, remaining 6 feet away from people at home if possible, if someone is symptomatic, as well as when you're outside and going to work is really the clear directive. You know, washing your hands frequently. We're back to the original messaging around this. Washing surfaces as well with soap and water works is something we heard today. And then wearing your face mask when in sort of in close proximity in indoor places. And really, as Dr. Adgate mentioned, it's the fit of the face mask that's so important. You know, so making sure that it fits around the nose and around the bottom of your chin well is really important. So it's more important than potentially, or just as important as the materials you're using. So thanks again for everyone joining us. We will once again follow up with the materials from today's presentation, and stay safe, stay healthy out there. As we've mentioned multiple times, public health is now more of a priority than ever before, and we want to continue to share trustworthy information with you. And we all have a part to play in this. We're all in this together.